Is bleeding at 6 weeks always a sign of a miscarriage, or are there other possible causes?
Welcome to today's video, where we will be discussing the question, is bleeding at 6 weeks always a sign of a miscarriage, or are there other possible causes? We will explore this topic by breaking down the answer into different sections and highlighting the important parts.
What is a miscarriage?
A miscarriage is the spontaneous loss of a pregnancy before the 20th week. It is a relatively common event, affecting about 10 to 20% of known pregnancies. Miscarriages can occur for a variety of reasons, including chromosomal abnormalities, hormonal imbalances, and other medical conditions.
Can bleeding at 6 weeks be a sign of miscarriage?
Yes, bleeding at 6 weeks can be a sign of miscarriage, but it is not always the case. It is important to remember that every pregnancy is unique, and not all women who experience bleeding at 6 weeks will miscarry. However, it is crucial to consult with a healthcare professional if you experience any bleeding during pregnancy to determine the cause and receive appropriate care.
What are other possible causes of bleeding at 6 weeks?
There are several other possible causes of bleeding at 6 weeks that are not related to miscarriage. Some of these include implantation bleeding. This type of bleeding occurs when the fertilized egg implants itself into the lining of the uterus. It typically happens around the time a woman would expect her period and can be mistaken for menstruation. Implantation bleeding is usually light and lasts for a short period. Cervical changes during pregnancy. The cervix becomes more sensitive and prone to bleeding. This can happen due to increased blood flow and hormonal changes. Bleeding can be triggered by sexual intercourse or a pelvic exam and is usually light and brief. Subchorionic hematoma. A subchorionic hematoma is a collection of blood between the chorion, the outer fetal membrane, and the uterine wall. This condition is relatively common and can cause bleeding during pregnancy. In most cases, subchorionic hematomas resolve on their own and do not pose a threat to the pregnancy.
When should you contact a healthcare professional?
It is essential to contact a healthcare professional immediately if you experience any bleeding during pregnancy, regardless of the amount or duration. They can help determine the cause of the bleeding and provide appropriate care to ensure the health and safety of both the mother and the developing baby. In conclusion, bleeding at 6 weeks can be a sign of miscarriage, but there are other possible causes as well. It is essential to consult with a healthcare professional if you experience any bleeding during pregnancy to determine the cause and receive appropriate care.